Welcome and thank you for joining us this afternoon for today's Lunch and Learn, Asthma, Finding the Ease in Your Wheeze. My name is Kathy Churn and I am a consumer health librarian at East Brunswick Public Library. Today's program is brought to you by St. Peter's University Hospital and the library's Just for the Health of It initiative to promote community health and wellness. Our speakers today are Denise Kosnar and Robin Bergeron. Denise Kosnar is a nurse practitioner and Robin Bergeron is a certified physician assistant, specializing in pulmonary and sleep medicine. They are both members of the Division of Pulmonary, Critical Care, and Sleep Medicine at St. Peter's University Hospital in New Brunswick, New Jersey. They see patients independently and are passionate about assisting patients in obtaining and maintaining asthma control. Denise grew up in Piscataway and is a proud New Jersey native. She completed her medical education at Rutgers University while working as a nurse at St. Peter's. While not at work, she enjoys spending time with her 2-year-old daughter, Ellie, and her husband and her family. Robin is originally from Wisconsin, but moved to New Jersey to attend the Rutgers Physician Assistant Program. Along with her role as a PAC, she developed and manages St. Peter's Lung Health Program, which is a comprehensive initiative focused on screening for lung cancer, monitoring lung nodules, and managing patients with lung cancer. In her spare time, she enjoys teaching fitness classes and baking. Please be aware that this talk is being recorded. The recording will be available at ebpl.org/YouTube. If you have any questions, please type them into the chat box. Our speakers will answer questions at the end of the talk. Our speakers will not be able to offer medical advice to attendees during this program. And without further ado, I'll turn things over to Robin.
Thank you so much. Good afternoon, everybody, and thanks for tuning in for our presentation on asthma. This will just be a general overview for, just the general population, just a little bit about asthma, what is it, symptoms, some management, and how you can help manage your own asthma along with medications. Denise will touch on some of that, and I'll touch on another part of it throughout our presentation. Like she said, if you have questions, please ask them in the chat, and nothing too specific. If you do have more specific questions, we definitely recommend that you go see your healthcare provider. And if you are looking for a pulmonologist or some help with asthma or something, our practice is definitely available to help you as well. So without further ado, we will get started on a little bit about asthma. So maybe some of you are thinking, what is asthma? I think it's pretty common. A lot of us have heard about it, but really, what is it and what happens when we have asthma? So it is a respiratory syndrome in which our airways are over-responsive or hyper-responsive, and it creates an exaggerated response to a variety of stimuli. Different people have different triggers, which we'll talk about later. So different stimuli can cause this response. So you get contraction of the smooth muscle in the airway. So you get tightening and thickening of the airway. And you can see this in this picture as well. I'm not sure if you can see my mouse, but we've got a normal airway that's nice and open, and it's a normal size on the outside. And as compared to the asthmatic lung, you can see that there's tightening of the muscle around the airway. So that causes the airway to be smaller. And then we also have this lining that has become inflamed, and we have excess mucus. So we have airway inflammation, the mucus hypersecretion leading to the narrowing airways, and we can end up with airway obstruction. So a lot of this is a consequence of immune cells being activated and coming to that area. As far as the mucus, that can be due to a gene expression issue. So normally we can have mucus in our airway, and it's actually good and it's protective, and it helps with moistening the air as it comes through. But sometimes under stress, or when we have asthma or infection, something like that, it can cause the mucus to be a problem. So we get increase in mucus, overgrowth of cells, and that can cause some of that narrowing as well. And you can understand why a narrow airway would have difficulty with air moving through. So it can cause some of the symptoms of asthma. So of course, some shortness of breath if you're having issues moving air in and out of the airways. You can have a cough, dry or productive. So you might be coughing up some mucus or some phlegm, or you might just have a cough that you're not getting anything up. The classic signs of asthma would be the cough, the shortness of breath, and wheezing. So normally the wheeze is heard as you exhale. It can be different pitches and tones, different durations, different times during the respiratory cycle. So it varies. And patients can often say that they feel chest tightness. So sometimes it's like a heaviness on the chest. Sometimes they feel like there's a band coming around their chest as well. So that can kind of cause like some shortness of breath too, and obviously uncomfortable. Oftentimes we see that their symptoms are worse at night or in the early morning. And these symptoms, like I said, the different stimuli causing the contraction of the smooth muscle and the airway inflammation, they can be brought on by different triggers, and they're relieved with bronchodilating medications. And Denise will be talking all about the triggers and the medications that we use to help with asthma. So how do we end up with asthma? So that's kind of a complex question and answer, because it's different factors. So the strongest factor for developing asthma is it's technically a genetic predisposition to develop allergic diseases. So asthma, allergic rhinitis, so that's like you end up with nasal congestion, swelling in the nose, the nasal passages, and eczema or the dry skin. So there's definitely a genetic component, and then we often see in our asthma patients that they have a family history. Mom has asthma, dad has asthma, siblings, cousins, anything like that. So that's an important question that we ask our patients as far as their family history when evaluating somebody for asthma. And then also environmental factors. So maybe you do have this genetic predisposition, and then you get into contact with some stimuli in the environment that can really turn on the genes for asthma. So maybe being exposed to smoking, whether you're smoking yourself or secondhand smoke, of course, exposures in the workplace or exposures just in the air, air pollution, fires, chemicals, anything like that. Those are all things that we inhale that aren't clean air that can be definitely irritating to our airways. And when we're already having these hyper-responsive airways, adding that into it can really create a problem. So like I said, it's kind of a complex question, but definitely some different factors that play into whether or not you develop asthma, and can be also how bad your asthma is. So if we're thinking a patient might have asthma, we ask them their detailed, like I said, their family history, questions about themselves, exposures, anybody in the family with asthma. We see adult patients, so we always want to know, were you diagnosed as a child, or when did these symptoms occur? We have a very detailed history to evaluate these patients. So maybe we think they have a chance for having asthma. We want to do some breathing tests. So I won't get too far into the breathing test, but really it's to understand better their lung function. So there'll be different things they'll have to do, like breathing in as much air as they can, holding it, exhaling, and having tests of your lung volume and your lung functions. So this little thing over here is called a peak flow meter. And that's something that we use in the office to monitor our patients' breathing, and they can take home as well. So it's a little device here that we'd have a patient hold, and they would take a deep breath in and exhale as hard, as fast as they can. And that helps us give an idea of their breathing. And then as far as allergy testing, there's blood tests and skin tests. And some of the tests that we use would be to determine if the patient is eligible for certain medications that might help with their asthma. So it's really, our evaluation is a case-by-case basis. So depending on what we think the patient needs or their history, different tests have different utilization. So you have these tests done, you're diagnosed with asthma, now what? So the management of asthma is multifactorial. So we take all these things into consideration. So, like I said, Denise will talk about the triggers. So avoiding and eliminating triggers or things that are causing you to have asthma symptoms. We definitely take a lot of time to educate our patients, just like even some things from this talk, what is asthma? How do we get it? How are we testing for it? What are we doing? What can you do to help your asthma? How do you use your medications? All these things are very important. Like I just touched on the medications, the pharmaceuticals, so medications that we prescribe to help patients, and then the objective testing. So like that breathing testing that I touched on, helping us to track our patients. So like I said, really just touched on the education. So we are telling them all about asthma. a really, really important thing that we touch on with every patient, no matter how long they've been our patient or an asthma patient. You know, if I've seen you 20 times or if I've seen you twice, we're going to talk about how to properly administer your medication, because too often people just aren't using the medications correctly, or just having different techniques that aren't the best, and it's not giving their allowing them to get the medication correctly on their best way. So we always go over that, and definitely providing tips and techniques for decreasing asthma exacerbations or asthma attacks or issues and controlling their symptoms. We also go through an asthma action plan. So you can see over here, we just use the numbers from their breathing tests to kind of give them an idea of their ranges. So we have a green and a yellow and a red zone. And really just essentially that's just helping for the patient at home to understand their asthma and when they might need help, you know. So they'll use that little peak flow meter that I showed previously, that little device, and get their breathing numbers. And that can help them understand, you know, which medication they need to take at a certain time. And, you know, is it time to get help? Because unfortunately, sometimes the medications at home aren't enough, and we do have the triggers and we can be set off with our asthma. So always aware of, you know, when we might need help or what medications we need to take at a certain time. So like I had touched on the objective testing before, so that just gives us numbers, you know, compared to subjective, you know, how the patient feels and stuff. So we have the pulmonary function testing, spirometry, the peak flow meter, that little blue device, the blood test, and the allergy testing. So Denise will touch more on this, but allergies definitely can be a trigger for asthma. So sometimes the testing to help patients understand what to avoid, what's setting off their asthma. We use different blood tests to test for different molecules and levels in the blood to determine, again, if certain medications will benefit a patient or not. And then, like I said, all the testing we do is just on an individual basis, what we think that individual patient needs. And it's not just cookie cutter for all people. So really individualized. And so our next slide is on the medications, which I just briefly touched on. And Denise is going to go into a little more detail about how we help manage patients with pharmaceuticals.
Hello. So now my name is Denise, and I'll just be touching on now you have asthma. So we've gone through the testing. We know about what asthma is. You've seen a medical professional, and now you've determined that you have asthma. So what is something we can do, and how does some medications work? Some people that maybe are on this are on some of these medications. So we'll talk, I'm going to touch a little bit about how they work, how we can control our asthma, so people don't have long-term effects and can live healthy, happy lives with asthma. So there's two main types of medication. We have a short-acting medication and a long-acting medication. Short-acting medication normally is our rescue medication. It's a medication that will work very, very quickly if you're having any kind of symptoms like shortness of breath, wheezing, just difficulty moving air, chest tightness, things of that sort that could be affected by a variety of different things. And we'll go over some triggers as well. And then also maintenance medications, which we often term our long-acting medication that you would take every single day on a daily basis to help manage your asthma and to keep it controlled. So there are two other kind of main medications with short-acting and long-acting. One is a bronchodilator. So a bronchodilator relaxes the muscles in the airway. These medications are often our rescue short-acting medications. They work quickly, they relax the muscles. So if you're having some issue, these medications can help more. Some types of medication of our bronchodilators are albuterol. These are maybe some that people have at home, I'm not sure, but some names are albuterol, which could be Proair or Ventilating, Xopenex, Atrovent can be some forms of our bronchodilators and our short-acting medication. We also have something called inhaled steroids. So steroids come up a lot when we talk about asthma. The steroids that I'm talking about are an inhaled steroid. They're in an inhaler form, and they're normally our long-acting medication. So these medications are either used twice a day, once a day, 2 puffs, 1 puff, however it is with that, you're prescribed from your doctor, but they're normally used on a consistent basis. And what these medications do is they decrease any inflammation, and they reduce the immune system reaction. So I know Robin touched about maybe why we have asthma. So inflammation, immune response. So these medications work directly on that to control the asthma. But what's important is that these medications are used on a daily basis. So you might think, I'm on an inhaler, my asthma is doing really good, I'm having no symptoms, let me stop it. That's the worst thing you can do. So you will have to talk to your provider about how you need to take your medication. But when you're on a daily medication, the most important thing is to take that medication daily. All right. So what can trigger asthma? This is quite a long list, unfortunately, so it's not something that is small. Stay away from one thing and your asthma will be great. There's a lot of things that affect asthma, as Robin said, how we're triggered, our immune response, allergies. Allergies are one of the main things that can affect our asthma. So anything that you're breathing into the lungs that isn't the beautiful air we have outside is something that can actually exacerbate asthma and cause inflammation, aggravation to the airways, and those in fact can cause symptoms. So smoking, number one thing that can exacerbate any kind of person with asthma. Even someone that has asthma can be walking by somebody that is smoking and all of a sudden maybe is wheezing or having difficulty breathing, probably because it aggravated the insides and aggravated the lungs. So smoking or being around smoke. Humidity, so air and temperature affects our asthma, unfortunately. Humidity can increase the inflammation. Cold air can constrict the airways, which can also lead to poor controlled asthma and increased symptoms. Air pollution, pollen, animal dander, unfortunately cats more than dogs, so cat hair, some dogs that are shed a lot, things of that nature can really affect our asthma. Cockroaches, dust mite, mold, and urinary protein specifically from rodents, so like mouse and rat and things of that nature. Okay. So this is quite a scary picture, but this is a dust mite, and this is something that's on this is a large picture of this guy, but on a smaller scale, this can really affect people's asthma. So it puts it into perspective that very small things, though even unseen, can really make an effect on your asthma. So maybe some diseases or conditions that can worsen asthma. We'd like to think again that asthma is something just easy and narrow that we can take care of, but unfortunately it's not. It's triggered by a lot of things, and also a lot of underlying conditions can also exacerbate it, specifically worsen symptoms. So the first thing is obesity. So obesity can aggravate asthma, as the inflammation is complicated by obesity because certain cells that affect asthma can be altered due to increased adipose tissue. So if you have increased tissue, it can affect some of the cells that work on asthma and increase your symptoms. Also, in general, carrying around extra weight can make it more difficult to breathe, even in humid air, or if you're exposed to an allergen, if you're carrying around extra weight, it can be a little bit more difficult to get that breath in because you have extra adipose tissue. Obstructive sleep apnea. Obstructive sleep apnea is cessation of breathing during the night. So it's an apnea or stopping breathing during the night. This can affect asthma because this can increase symptoms at night. People with asthma do often have some increased nocturnal symptoms, we call it, or symptoms at night, and treatment of obstructive sleep apnea can actually help manage your asthma because it helps get better air and oxygen flow at night, decreasing your nocturnal symptoms, and also not irritating the upper airways. If you're not getting enough air, oxygen breathing at night, our upper airways can be aggravated and it can increase your asthma symptoms. So this also goes along with allergic rhinitis. Allergic rhinitis is another way of saying postnasal drip too. And these both can aggravate your asthma because it's the upper airways. If you have something that's dripping in the back of your throat or some allergens that are causing nasal congestion, it can all aggravate the upper airways, causing increased asthma symptoms. Acid reflux. Unfortunately, a lot of people suffer from acid reflux. This aggravates our asthma as the stomach acid can leak into the esophagus, creating a chain reaction. leading to asthma symptoms. So you have the reflux gastric acid, which is irritating the nerve endings in the esophagus. And then what that does is it stimulates mucus production, and also the muscles will also be aggravated. So it will affect the upper airways and the small areas of the lungs, resulting in increased asthma symptoms. Also, in some cases, reflux can cause something called aspiration, we call it, and that's regurging some of the food, which can irritate the small airways and the upper airways, causing asthma symptoms. Wheezing, you're not getting enough air circulation going through. Inflammation can occur because of all of this, causing more difficulty breathing and increased asthma symptoms. And then smoking, as I said before, irritants, any kind of irritants, we should not be inhaling anything into our lungs except air, and any of that can cause inflammation, irritation, all the above, and can irritate our asthma symptoms. So how can we control asthma? So we know what affected asthma. We know what medications we can take to treat our asthma. And so what can we do? So use of medications as directed is the main thing. If you are prescribed medications to treat your asthma, taking it consistently, not stopping unless you talk to your healthcare professional, and correct technique. I know Robin spoke about that, and I'll just reiterate, we see people in our office all the time, I know there's many commercials out there for a lot of different inhalers that look like discs, inhalers that you pump, inhalers that, you open up a lid, whatever it is. So using the inhaler correctly is very important with correct technique. If you're using an inhaler and the medication is not getting into your lungs, it's not going to be helping your asthma. So on every single appointment that we do with our patients, we always make sure that they have proper technique, know how to use their inhaler, and are using it correctly. That's number one to treat our asthma. And avoiding allergens. So I talked a lot about what can increase our asthma symptoms. So things like, we want to make sure that you're staying away from people that smoke. If people smoke in your house, or if you have friends that smoke or anything like that, that can make a difference. So we want to make sure that we, stay away from things like that. Also, cleaning our house well. Again, dust mites, animal dander. If you have cats, we hate to tell people to get rid of their beloved animals, but at least make sure vacuuming well, making sure dusting, if you have carpets in the home, making sure all of that is clean, changing your air filters, stopping smoking if you do, and identifying your triggers. So some people will be triggered by certain things, maybe a certain cleaning product really have caused someone to have a lot more problems than another cleaning product. So making sure maybe what triggered you and staying away from them. So we try to help our patients. We go down a list when we see them, maybe what is irritating for you might not be irritating for somebody else, but knowing that personal triggers for yourself and staying away from them as much as possible. So how can we help you? So we do, again, asthma is not something that is, cut and dry. There's a lot, it's complex, and a lot of things can affect certain types of asthma and the way we control our asthma. So we want to make sure we manage all the conditions. There are certain, again, underlying conditions that can affect our asthma. So, sleep apnea, pulmonary fibrosis, pneumonia, sarcoid, some of these things listed here that could affect our asthma, and also just lead to other respiratory diseases as well. So we can help manage all of these conditions. Asthma is reversible. So we use our medications right. We follow the instruction of our physicians, stay away from our triggers, as people can live very long, healthy, happy lives with asthma. But uncontrolled asthma, not taking care of your asthma, taking your medications right, could lead to something called chronic obstructive pulmonary disease, or COPD, which leads to more management, can be more of a debilitating disease, and be harder to control. So we want to make sure that we don't get to that point, and if you have underlying asthma, or patients do, that we control it as much as possible. And just a little excerpt about asthma and COVID-19, because obviously everything right now. COVID-19 has been a hot topic. So good on the asthma front is that they did a lot of research and analysis of people with asthma and COVID-19, and they did not find any clear evidence of increased risk of COVID-19, diagnosis, hospitalization, severity, or mortality in patients with asthma. So just because you have asthma, it's good news that you are not any more at risk for people that don't have asthma in having problems with COVID-19, getting COVID-19 or hospitalized or mortality of COVID-19. That saying, we're still encouraging, obviously, people to wash hands, wear masks, social distance, get the vaccine, things that we could prevent in general COVID-19. So that's actually the end of it. So I don't know if we have any, that was just a kind of an overview. We have any questions? I think we already do. So, so we have a couple questions. We actually had a previous question too that was read to us by Cindy. So just to address that, I believe that was about allergens and asthma as well. So this person was having some allergy issues. So as Denise said, allergies are definitely a trigger. So if you're having uncontrolled allergies, you definitely can end up with having uncontrolled symptoms of asthma. So we definitely recommend that, as she talked about underlying symptoms, we need to control the underlying symptoms to control our asthma. So we would just recommend for anybody in that situation trying to control something, definitely meet with your healthcare provider, or again, if you need a pulmonologist or something, you know, our practice is certainly happy to help anybody. But the underlying conditions are really important to asthma management. And as Denise said too, that you can definitely take care of your asthma well and live a long, happy life and nobody even knows you have asthma. But if it's not taken care of, you always have issues. I mean, that could mean being on steroids, not the inhaled ones, but ones you take systemically. That can mean hospitalization. That can mean remodeling in the lungs, which Denise had touched on, that causes changes in the lungs that are not reversible and definitely can end up being debilitating. So definitely want to get asthma under control for sure. So we have a question, is it a good idea to keep windows open when cool outside or have air conditioner on instead? I can go. You can go. No, I would say, so if you have, like environmental allergens, so when the pollen counts are really high or something, and you have allergies to pollen, and that can cause asthma symptoms, I would say better to keep the windows closed because you'll just decrease, the pollen you're exposed to, or if you're at trees or grass or, whatever, anything from the environment. As far as having the air conditioner on, the air conditioner can make your house dry. So dry air can cause irritation to anybody in the airway, even if they don't have asthma. So in that situation, if you are using the air conditioner, I would say maybe using a humidifier as well, because then that will add some moisture into the air, which will help you as well. So I guess that's kind of your personal preference for what you're more comfortable with. But yeah, if you have your windows open, unfortunately, those allergens can get in. That's what the one about. Yeah. Windows open. Okay. What is the difference between, I think they're saying Ventilating, parentheses 40 minutes, and Proair works 5 to 10 minutes, fight with my insurance to get my doctor. I'm not really sure what the question is on this one. I apologize. Ventilating and Proair, I will just, again, I don't really understand this question too much, but Ventilating and Proair are essentially the same thing. They are Albuterol. It's just Proair is a brand name. They're also different. Proair it gets a little complicated, but Proair comes in a Respaclick versus an HFA, which is just a different way of getting the medication. So they are essentially the same thing. Unfortunately, insurance sometimes does dictate which inhalers are covered. So I'm not exactly sure of the, let me see if she...
What's the difference between Ventilating? Maybe you're saying 40 minutes onset to working versus the Proair works in 5 to 10 minutes. I would disagree with that because they're actually both short-acting medications. So you would take Ventilating if you're having, asthma issues, you're having shortness of breath or that chest tightness or wheezing, you would want that as a rescue. So you wouldn't want it to take 40 minutes to work, and it shouldn't. So again, I would say discuss with your doctor then, as far as your fight with insurance, unfortunately, we deal with the insurance companies every day, and it is a bit of a fight sometimes. So good luck with that. We have another. I've never found the rescue inhalers to do much. When I'm having a real coughing fit, I'll take albuterol. It has very minor effect. I always wonder what people do if they're having even a more severe fit than I am. So I would say, first and foremost, if a patient said this to me or called, said I'm not feeling well and I'm taking albuterol and it's not helping, I would go over the technique. And that's not to talk down to people by any means. It's that, as Denise said, like these inhalers come in all different ways to take them, and inhale slowly, inhale quickly, like it can be a lot. And it can also be coordination. So if you're taking a puff off an inhaler, you have to coordinate, the releasing the medication with the correct inhale as well. So I would say, making sure you're taking it correctly, making sure it's not expired or old, making sure you have the good coordination. And then, if you're having real coughing fits and issues, like maybe were you just exposed to something? Did you just walk through a cloud of somebody's cigarette smoke or something like that? So the underlying conditions as well. And people that are having more severe fits than you are, unfortunately, if a patient is having asthma symptoms that are not relieved by albuterol, at that point, we recommend getting medical attention and getting help, because while the airways become more inflamed and angry and irritated, they get smaller and smaller. And if the albuterol is not working to bronchodilate or open up the bronchioles, then unfortunately, it kind of only gets worse from there. So you might need medical attention.
And then there's the question, is there any benefit to taking albuterol through a nebulizer versus an inhaler? So again, it goes back to technique. Some people find it easier to use a nebulizer. There's a lot less coordination of, pumping the aerosol spray down, taking a breath in, getting the medication. So some people find that they have better relief with the nebulizer because the coordination is a little better. So that would be a personal benefit. So possibly if maybe there's a suspicion that the inhaler technique is not correct, as in you're not getting enough relief from the albuterol inhaler, sometimes taking the nebulizer, people find work better for them because it's a little bit easier to use.
And then another question, how often are new asthma medications approved for use? So there's one class of medication that we didn't really touch on because it's not appropriate for everybody and it's a little bit more detailed, and they're called biologics. So they're medications that are injected with needles or through an IV or something, and some patients require that. It's not daily, it's like every other week or monthly. So recently Dupixent was approved. So I guess recently there was one that was approved for a different indication with asthma. But there's always research going on with the immune system, and asthma has obviously an immune component. When we talked about that in the beginning with the different immune molecules and cells adding to the pathophysiology or the disease process of asthma. So, as far as the albuterols and stuff, those rescue inhalers, a lot of them are kind of tried and true, like been around for a while, but they're always doing new research on different medications and methods of administration. So the inhalers and nebulizers and all that. Is there anyone else? Oh, we got a question.
We have a question.
So go ahead. So the question, somebody had shortness of breath and their hemoglobin caused the shortness of breath. They had to get blood transfusions. So, your hemoglobin and your red blood cells they just wanted to know about explaining that, have to do with oxygen delivery. So if you're not getting oxygen delivered correctly, obviously having shortness of breath. So it's just really the same thing as if you're not able to breathe in oxygen, you're not going to have the oxygen and going to have shortness of breath. I'm sad that was misinterpreted for you with your shortness of breath, and glad that you got the help that you need and got blood transfusions and hopefully got the medical care that you needed. And I would definitely say to continue seeing your provider regarding that. Are there any other questions?
So I'll just do a last call for questions.
Got a straggler. Oh, okay. Just thanks.
Okay. So if there are no more questions, then we'll conclude here. And so thank you, Robin and Denise, for taking the time to present on this topic, and then also for answering all of our questions. So
Sure, yes, thank you so
thank
much for
you.
having us. We hope you guys learned something. And of course, please call our office if you have additional questions or are looking for a provider. But thank you so much.
All right, great. Thank you so much. And for everyone who's attended, thank you so much for attending. Our health series with St. Peter's will continue in the fall, so just keep an eye out for those upcoming programs. And thank you everyone again, and take care and stay safe. Okay, thank you.
Thank you.
Bye.